So I had a question recently about whether a dead hang is good for a lumbar disc issue. So what that would mean is basically you hang on to a bar like you're going to attempt a pull-up, and you just let your weight and gravity kind of distract the spine and the segment. So the answer, like a lot of things with spine-related injuries, is yes and no. I mean, that one can feel good because it creates space and kind of opens up that joint space. But of course, you can't stay there and hang, forever. You can't live like that. And a lot of times, when you come back down and you reload your body weight and gravity, then it pinches again, and it's sometimes even worse afterwards. So it's worth a try. You could definitely give it a go and see, what the results are. Like anything else that we do, you have to use a cause and effect relationship. How did you feel beforehand? With pick some kind of movement, whether it's bending forward, bending backwards, sitting. Like you got to get a baseline, and then try it, and then retest that thing. The other thing that I would do with a dead hang is, before, I would warm up a little bit with some general movement, walking, and then after, I would incorporate some form of extension to make sure that posterior disc bulge or herniation, you're putting some pressure on that and trying to move that out of the way after the dead hang. So dead hang, 25, 30 seconds, if you can hang on for that long, 10, 15 if that's all you can hang on for. And then follow that up with some extension and lying. So lying your stomach, that way you're still unloaded. So you'd come down immediately to your stomach and then do the press ups with the chest up high. And that should help, keep that disc more set in the middle of the back as opposed to pushing out after the dead hang.